Twins World, all about parenting. Hope you all are safe and sound in your own places. Today we are going to talk about another day that we are celebrating, that is Autism Awareness Day. And tomorrow is the day it is celebrated. If you ask me why am I discussing about all these important days, these are very much important in terms of children. And autism is a condition where there is a developmental disability. That means we know that when a child grow, we can see in the weight or the height of the child can be improved, whereas the child's milestones, that is the child will not be able to have a head control initially. By 3 to 4 months the child is able to hold the neck, then after some months the child will be able to turn to sides, after some months the child is able to sit up with support, without support. This we call it as milestones. But in these children there will be delay in these milestones can be seen, and this is mainly due to a different functioning of the brain. It is very difficult for identifying the children with autism because there is no test, no blood test, no investigation to diagnose a condition called autism, whereas an expert person, that is a pediatrician or a psychiatrist, that is child psychiatrist or the psychologist, is able to understand by seeing the developmental delay in the children. So it is very difficult, and mainly this kind of children is identified with autism disorder from 18 months of age, that is 1.5 years old. So it is very difficult for parents also to understand that my child is undergoing this particular illness. If we are asking what are the signs and symptoms of this kind of children, the first thing is the child will have issues with communicating with others as well as a social interaction. So the common features of the child with this particular condition are: the child may not respond to their name even after 9 months of age, and if they call them, they may not even maintain an eye contact with you. Even these children will not even smile at you if you are giving a smile or trying to contact this child or communicate with this child. Moreover, you can see that the child is not able to give you a bye-bye, which is expected to do by 9 months. Even at 1 year also the child is not able to say bye-bye. The child is not interested, and the child will not be interested to share their things to others. The child is happy in his own imaginary world. This is the main characteristic feature of autism child. Even the child is not able to notice that you are hurt or you are affected. Even by 2 years the child is not able to identify or understand. Moreover, by 5 years also the child will not be dancing or acting or taking part in any kind of interactive play that you can see in these children. So what all things I explained comes under the way the child communicates with others and social interaction. The second main characteristic feature of this autistic child is repetitive behavior. So you can see this kind of children keep on repeating some phrase or doing some particular activities, that they are rotating a wheel in the hand or some toys in their hand. So they find more of happiness in doing that particular activity. Moreover, than a car, he may be more interested in the wheel of that car. So he will be fondling and playing and try to pick up the wheel of that particular car. So this kind of character is also well evident in autistic children. If you see the child's pattern of play, the child will be playing with the same toy every time in the same manner. So this also one of the identifying features of child with autism. Moreover, these children flap their hands, rock themselves, spin their body themselves. So these are some of the repetitive movements what you can see different from a normal child. If you see other behavioral or delay, that what you can see in this kind of children is their language may be very delayed. They may not be able to talk like other children on all the days. Even though these children are having delayed learning skills, we can train them with what mental capacity they have. Moreover, their sleeping pattern may be differed or unusual eating pattern they have. Then they may not be fear of anything, or they are very scared that they may not be wanting to see others. This kind character also can be seen in this kind of children. Moreover, epilepsy or the fits that we discussed last week also can be seen in this particular condition. These children are very well known for their mood disorders. That is, they may be angry, frustrated, throwing tantrums. So these are also another characteristic feature where the parents themselves will understand that my child is not behaving normally. If you ask how to manage this kind of children, actually there is no management. We can work with a variety of management techniques so that we can manage a child with autism. We can give them developmental therapies, like the child is delayed in speech, we can go for a speech therapy or a language therapy, or we can give some occupational therapy. There is a child will be able to train for a living or train for basic skills. Even education is also a special education, and special educators are needed to take care of this kind of children. We need to teach them how to socially relate to the next person, how to share and how to behave in a group of people than being alone. These things can be taught to the child. Moreover, if being a father or mother of this kind of children needs a lot of perseverance and patience, because this is not a normal thing. The second thing is, whenever we are talking to the child, call her name or call his name so that the child will be able to understand that we are talking to the child. Otherwise, the child will be in his or her own world, whereas she or he doesn't want to be interrupted. Use simple commands while talking to these children, and if you can use some action so that the child is able to understand what you want to communicate with the child. Try to maintain eye contact with the child so that the child is also trained to look at your eyes and talk to you. See, making a routine for these children is very mandatory. So avoid any chance of changing the routine in the child, because that brings fear or a kind of confusion in the children where the child is not able to function more. Moreover, avoid noisy or crowded places or bright lighted places, and make them away from all these things, because these things can trigger them and bring them chaos in them. So this is a nutshell information about autism, and it is very difficult to identify what is the cause or how to manage this kind of children. Hope this session has brought in you in nutshell the awareness on an autism. Till we meet with another important topic in next week, stay safe and stay happy. Thank you.